about risk factors for developing dementia, there's modifiable and non-modifiable risk factors. So the non-modifiable risk factors is age and also genetics, but the genetic component is actually quite small. The modifiable risk factors are things that we can address and should be addressed across the course of our lifetime. So it's very hard to imagine that as a child you need to be preventing dementia, but by getting a good education is one of the first modifiable risk factors. The other risk factors are very lifestyle related, so managing, getting good early habits of looking after your diet and being active are very important. For as we get older, we don't want to develop chronic health conditions such as diabetes and high blood pressure and things like that. So by looking after your weight and by looking after your activity, that's a very good way of starting to prevent dementia. If you have any problems with your hearing, getting your hearing loss addressed and wearing your hearing aids is very important. We need to consider our alcohol and our tobacco consumption. They're two risk factors for developing dementia as well. So generally speaking, by living a healthy lifestyle, by having what's called a Mediterranean style diet, where you've got lots of good leafy vegetables and lots of antioxidants in your diet and good healthy fats in your diet, and by doing a tremendous of activity 5 times a week that raises your heart rate above its normal rate is very good for you. It's good for your heart and it's also good for your brain. Also, social isolation and depression are risk factors for getting dementia. So remaining socially active, doing things like volunteering or being involved in some groups in your community. We've got men's sheds, we've got activity groups offered that can provide people with good social connection. That's also very good, and also doing things that keep your brain stimulated, so going and learning something new or doing a new activity is very helpful. So all of these preventative measures have been shown to collectively reduce the risk of getting dementia by about 40%, so that's quite significant. So if you're worried about your cognition, it's really important that you get it checked out, because what we can do is determine whether what you've got going on is normal for someone your age or whether it's different. So by having some testing done that determines that, you can then either do something about it or you can stop worrying about it.